Okay, so here I am. Little story. Up until I rolled into Puerto Vallarta, I had no idea what I was doing, where I was going, who I was supposed to meet. Well, they did give me directions of who I was supposed to meet at the airport, which went very, very smoothly. But I was handed this little package when I got here, so I'm going to open it on camera and see if there's like a secret decoder message with a secret decoder to tell me what the hell I'm supposed to be doing, where I'm supposed to go for my surgery. I don't know what hospital, I don't know what time. It's hard to open with one hand. Learning together. Oh, hey, look, they gave me 20 pesos for some reason. That must have a purpose. Welcome to Puerto Vallarta. My name is Natalie, and I will meet you at the Cornerstone Hospital. Oh, I guess I'm going to the Cornerstone, which is the newest hospital here in Puerto Vallarta. They've changed. They were doing all their surgeries at the San Xavier, so they've changed that. Which is 5 minutes away from the hotel beside Gigante Mall, in case the taxi driver needs directions. On Tuesday at 9:30 a.m. So that's when my surgery is going to be, on Tuesday at 9:30 a.m. You just have to take one of the yellow taxis that are at the lobby. In the envelope, you'll find 30 pesos. Oh, I got ripped off, man. There's only 20 pesos in there. What the heck? Maybe there's the other 10. All right, found my 30 pesos. This is fun. It's like a treasure hunt. You will need to do your checkout at the hotel. I strongly recommend don't bring all your luggage with you if you have too much. You only need your personal things so that you don't have to be moving your luggage back and forth. You can ask, do you want to see this? Probably not. You probably don't even want to hear it. The bellboy to store it until you come back for your recovery. You're going to need to stop eating and drinking at 10 p.m. the night before. So tomorrow night, 10 p.m. Dong. That's the end. Because we are going directly to the hospital for the blood tests and to get you ready. So if you want to swim, now is when, because after surgery, not very recommended because of the stitches. So enjoy your stay, and if you have any questions, please call me. Taxi directions. There you go. Lovely. So there's my secret decoder message. Okay, there you go. See? Mm-hmm. Well, it's the morning of my surgery. It's about 20 after 8 in the morning. I have to be at the hospital by 9:30. I'm not really feeling that nervous, surprisingly. I slept okay last night, and I don't really feel that nervous this morning, which is kind of odd. I thought I would by now, but I'm sure that will be coming. Trip so far has been really good. Everything's gone really smoothly. Albeit differently than things are done back home, but I am in a different country, so that's to be expected. But yeah, a pretty smooth transition to surgery, I guess. I went to Walmart yesterday here in Puerto Vallarta, and we got some stuff. I'll just quickly show you here. Well, see what I'm filming. We got that cooler, so I bought some pre-made Jell-O, and some water, and some juices and stuff like that for after my surgery. And then we got a few groceries too. Much of this is for my friend, as you can tell by the bananas and stuff. But I got myself that mug, and there's some soups right there, and that's the containers of Crystal Light and broth stuff that I brought from home. So, yeah, you can pick whatever you might. Oh, I gotta zoom out. Sorry. Oh, I'm a dork. You can pick up whatever you might not have been able to or forgot to bring from home easily. There's every possible thing you could need in this town. So my friend's gonna go buy me a kettle. There's not kettles in the room here at the NH Crystal. So just a little tip, if you don't bring something to warm water with from home, then you need to get something here. The other thing about the NH Crystal is the beds are like sleeping on cement. So when you get here, just ask your bell person or your porter, I guess, or your room, your room person, I don't know what they're called, to just bring you an egg carton mattress topper, or even two, actually. We have one in our bed right now, and I'd really like for there to be two on it before I come home from surgery. So I think I'm going to ask for that soon. And they will give that to you, and it's so much better. There is an iron and an ironing board if you need that, and yeah, so sorry this video is very dark and also very close to my face, but I didn't bring my little tripod, so I have to hold my camera whenever I tape my face, my talking head. Other than that, for now, I'm going to start filming again, obviously, at the hospital, but I just wanted to give you an update on how I'm feeling right now, and I feel fine, really. I feel kind of like I just want to get it over with and get on with my life. So, yeah. See, we're here. Hello. I'm in my hospital room now, but I haven't had anything done. I don't even have my IVs yet. They checked us all in, had a little cry, had a meltdown because the band I wanted to get, which is the Johnson & Johnson Realize band, that little piece of information was not communicated correctly to my surgeon or his patient coordinator, so I'm not getting that band, but I'm actually fine, whatever. Dr. Hoya came in and had a long talk with me, and you know, the important thing is that I get the band that's right for me, not the one that I think is right, so I'm fine. Whatever. I just didn't like showing up and not having things the way that they said they were going to be, or the way that I understood they were going to be, so that's that. And I guess now we're just waiting for a nurse to come in and give me my IV and get me ready to go into surgery. She said it'll take 40 minutes to prep me for surgery, getting me strapped down and so on. Strapped down. And it will take 30 minutes to do the surgery.
Do you want your air conditioning on?
No, thank you. Okay, you're filming.
Why not? She has her IV now.
Okay, you see the blood on the bed? I don't think I've got sleepy stuff in there. I'm just tired. I think it's just saline.
It's just saline. So, how was the IV?
It was alright. It was a little weird. They do things differently here than they do in Canada in that respect. She stuck the IV needle in and then just tipped it and let my blood run out all over the place and filled a vial. Filled 3 vials with it. So it's to avoid having an extra poke, which I believe to be true because in a hospital in Canada and other places I've been, they actually will take your blood from, like IV you here, but take your blood from here. So yeah, but there was a lot of, I could feel it running all down my hand. Can you turn it off now?